will be there answering your questions post the presentation till today night 9 o'clock. So, Yusuf sir, are you ready? Dr. Jashan, please unmute Yusuf sir.
Yusuf sir is unmuted.
Yeah. Yusuf sir. Yusuf sir, are you ready?
Yeah, I'm ready only. I'm actually Chunawala. I'm not ready.
Okay, Yusuf ready. So my mistake, Yusuf Chunawala sir. Are you ready?
Because see, if you use the word ready, na, I remember the Andhra biryani because I did my MDS from Davangere. So the Andhra biryani is still in my heart and I'm unable to eat anything outside. So
that's great.
The word ready is dangerous, you know.
So the entire side is yours now.
Yeah, just give me a moment. I will just go back to my slide sharing. Okay,
Yeah.
so I'll just connect with my slide ka thing.
Okay.
Just give me a moment, please.
Yeah. Dr. Jashan, are we YouTube live right now?
Yes, sir.
Sir, you'll have to give me a chance to share now because I'm unable to share content.
Jashan, please check.
Okay.
Sir is not able to share the screen.
Yes, I'll do that. Sir, please check now.
Okay.
Yeah, I can. I just give me a second.
Yes.
Oh, सामने इतना बड़ा काऊ को इतना बड़ा पीछे रहता है
उसी को बोलते हैं हम.
Just a second. We here. Just.
गजानन सर काऊ बहुत आ रही है.
कर दिया म्यूट कर दिया मैंने.
कर दिया.
अनम्यूट कैसे हो गया था वो पता नहीं चला.
हाँ ठीक है.
हम लोग को लगा नासिक में अपने एक साइड बिजनेस में डेयरी फार्म चालू कर दिया है. डेंटिस्ट्री बंद है तो. फ्रेंड्स, सबर का फल मीठा होता है. यूसुफ सर आज अपने को ये बता रहे हैं. जस्ट वेट, इट्स गोइंग टू बी रियली गुड टुडे.
Just a minute.
In fact, friends, I would like to tell about Yusuf sir. He's really greedy of knowledge. Even after so many lectures, today he is ready to give the first webinar of his life. In fact, second webinar of his life, and he told us, "I'm really grateful to you all because he got to learn how to give lectures on webinar because of our presentation." Thanks, sir.
Just a moment, sir. Just a moment. Now, a lot of slides are there today, so I hope I am able to finish it on time. Yeah, now, so very good afternoon to all of you all. It is almost 3:35 and it is chai time, na? So I hope all of you all had the opportunity to have some tea also. Keep your tea at the side and some biscuits also because this presentation is going to be might take some time. Now, suddenly we have bumped into a very different kind of scenario actually. I mean, we have never faced anything like this before. And before I start with my presentation, I would like to really thank IDA MWSB that they actually kept me busy. You know, I answered almost 300 queries in the past 2 days. And like, I felt really busy, you know, after a very long time, you know. So now, you know, like in this particular kind of an environment, what we should ideally do is that we should call up all our friends, relatives who we have missed out. And you know, the best part of this close down is that if you call up anybody now, he will not be able to tell you that he is busy. You know, and the only thing he might be busy, which he will very shyly be able to admit, that either he has to wash clothes or he has to do some sweeping around or Bendi Katna and all these projects. So generally, very few people have the guts to tell that way. So they tell, nahi, main free hu, aap batao. You know, so now inspiration can come from anything and anywhere, you know, because all have become artists. Has anybody got into this kind of an hairstyle of late? Because with the barbers not around, this can also be very impressive.
Sir, क्या करें, बाल बढ़ते ही नहीं है. बाल बढ़ते ही नहीं है अभी.
Now my topic for today is Fresh Breath Clinic. Now, the fresh breath clinic, in this I'll be covering basically bad breath and its management. So fresh breath clinic is basically a dental center where the major focus is on bad breath. Okay. Now, my first question to all of you all is that does toothpaste help us to cure halitosis? I mean, if people are, not all of them are muted, or if anybody can answer who is not muted, you
To
can
some
definitely
extent,
tell me. Does toothpaste help us to cure halitosis?
to some extent,
Yes, definitely. I mean, toothpaste are the best inventions. Yeah, somebody answer not to that level. Toothpaste definitely help us, but many doubts have been raised about the efficacy of toothpaste as far as curing of bad breath is concerned. Now, how many of you all brush today morning? Everybody, na? Everybody is brushing. Yeah. So this being a dental group, majority of the people would be definitely brushing, I'm sure. So what do you do after you finish your brushing? I mean, just observe very carefully that mostly after you have brushed your teeth. Now, don't tell me that 1 number and 2 number. I don't mean by that. Means once you are out. I mean, after you have brushed your teeth, the first thing we tend to do is try to drink water. I mean, most of us feel a bit thirsty after we have brushed our teeth. Has anybody noticed that kind of a thing, that we have an urge to drink water? Okay, so if you have not consciously felt it, today is the time. I mean, tomorrow you can check it out that after you brush your teeth, just check it out that you might feel like drinking water. Why do we feel like drinking water after we have brushed our teeth? I mean, because we brush our teeth with nice toothpaste and we are using a lot of water, but we still feel thirsty. So the beauty of the toothpaste is that, and today one more exercise you need to do is that what you should do is that you pick up your toothpaste today and go through its content. Going through its content is very, very critical in today's time, because just pick up your toothpaste and go through the content. One important thing you will notice that majority of the toothpaste that we are all using, they contain sodium lauryl sulfate. Are you aware of that? Sodium lauryl sulfate is the one of the main ingredients of majority of the toothpaste. And what is sodium lauryl sulfate? It is basically a detergent. Okay, it is because of the presence of the sodium lauryl sulfate is we get that foamy feeling. I mean, believe me, if the foam doesn't come out when we are brushing, we really don't enjoy the brushing. Okay, so the presence of foam is very, very critical as far as the brushing is concerned. So now, just to bring to your notice that sodium lauryl sulfate is a detergent, it is a soap, and the major action is the foaming action. But what it does is that it causes dryness of mouth. And my friends, dryness of mouth is the main cause of bad breath, or I can say one of the main causes of bad breath. So we have to be a little careful now, because see, majority of people who are suffering from bad breath tend to brush more often. And what happens as a result of that there is a possibility that, because of the dryness of mouth, the bad breath tends to increase. So now we are all on social media these days. We enjoy. I mean, we are on Twitter, we are on Instagram, we are on WhatsApp and TikTok. It's really fun. We really enjoy being on these social media sites. I mean, what would we do in this lockdown period? I mean, we are talking with each other because of Zoom. I mean, that is social media. It is the most amazing gift that our generation has ever received. But friends, don't we enjoy this more? Okay. I mean, we like to meet people. We like to catch up with people. We love to be at our clinics. We love to roam around. I mean, everybody's, humans are very much a social animal. I mean, they cannot survive without people. I mean, even in today's time, I mean, even the lockdown, I mean, if we are in a joint family, the fun is more because we have more people at times, just imagine yourself just being alone, or just the two of you all, or just the three of you all. It's so difficult because we are missing out the social component. I mean, in today's time, the best activity is to go to the bhajiwala. It is actually the most amazing thing today, right? Most of you all will agree, going to the bhajiwala or catching up with some small core is the best thing that we can do. So we are basically social animals, so we can't work without interacting with each other. Now, one thing you should remember that, we always need to make a very good impression. And if we have to impress people, we have to dress up really nicely. Our hairstyle has to be, really good. And, we have to use, like have a good bath, use deodorants. And, many things are taken up. I mean, I've just put in a list of things, that we need to, we try and attempt to make ourselves look good. But what happens? You look good, your hair is good, your dress is good, you have a designer watch, you have got designer clothes, designer shoes. But the moment you open your mouth, everything starts in. Okay? Has anybody experienced this kind of a thing? Oh my God, sometimes when we meet up with people and the moment they start talking with us, and we tend to back out by at least 3-4 inches. Okay, oh my God, this guy stinks. Okay. Has this happened with you all? And in dentistry, one of the main reasons why we mask is what? What is the reason for wearing a mask? One of the main reasons for wearing a mask these days, I mean, in today's time, it is more because of COVID. But otherwise, we wear a mask, because people stink when they come with dental problems. And that's why sometimes I thank my stars. One of the reasons that I'm a periodontist is because, we don't get, patients with severe halitosis. I mean, I really pity, many people, I mean, especially, the guys who come with so much calculus and tartar that the moment they open their mouth, they really stink. And just imagine going through all that calculus. Now, this is a small video, but unfortunately, I'll be playing the videos at the end. Here is also the patient with severe calculus. Now, is bad breath really bad? Or it is an understandable phenomena? It is a manageable thing. Can it cause any major problems in our lives? Yes. One of the severest problems that bad breath can cause can be divorce. I mean, you just can't talk with each other. You just can't communicate. What happens the moment the person opens his mouth and the stink puts each and every person off? Now, my basic question is, since most of the participants here are dentists, do we consider bad breath a problem, a major problem? Yes, it is. It is a major problem. I mean, though, in the last lecture, we discussed that many patients come to us with the complaint of pain. So pain being the main reason, and cosmetics. But there are a variety and many people are suffering from bad breath. And the beauty of bad breath is, what? That many a times the person who has bad breath is not aware of it. Because sometimes they have not been told only that they have got bad breath. So now, how bad is our bad breath? Have you realized? How severe can our bad breath be? Have you ever had an opportunity to visit a Sulabh Sauchalay? Anybody? Especially people in Bombay, Dadar station, the moment you get down of the bus and bang opposite, there is a Sulabh Sauchalay. I mean, Sulabh Sauchalays are beautiful places. The moment you enter and it stinks. It genuinely stinks. Okay? But after some time, what happens? You get used to the stink. What is the stink because of? It is because of the volatile sulfur compounds. One of the major ingredients of this malodor which comes out is volatile sulfur compounds. Now, what are these volatile sulfur compounds? These are compounds of sulfur which are the primary cause of bad breath. Hydrogen sulfide, methyl mercaptan, and several related chemicals are examples of volatile sulfur compounds. So the strong odor that you feel or you can sense or you can smell is because of the volatile sulfur compounds. So now if we break that down further, sulfur, garlic, rotten eggs, cabbage, that is what the stink is all about. Now my basic question is, who all complain of bad breath? Anybody in this group having bad breath? We are all dentists, so we know how to brush, we know how to rinse, we use the floss, we are using all the oral hygiene aids, and in fact we are the ones who are recommending all these oral hygiene aids. So does anybody? Yeah, see, we received an answer from Dr. Mustafa Khan. Not at all, sir. 100%. We are all dentists. How can we have bad breath? Okay, so now in 10-15 minutes, we'll decide on the final number of dentists who are suffering from bad breath. Okay. So now smokers. Do smokers complain of bad breath? Do smokers have bad breath? Yes. Smokers definitely are suffering from bad breath. And but believe me, they are the most wonderful people on this earth as far as the bad breath is concerned. Because you know what happens? What does the smoker do after he smoked 1 or 2 cigarettes? Any guesses? You know what they generally do is that they have a nice polo or a mint, you know, or Mentos, and there they are. So now, if you are in college or if you are working anywhere and suddenly post lunch, you get the fragrance of mint. What will you understand? कि साला सुट्टा मार के आया है ना? It is there. Sutta is there everywhere, but the smokers are so aware of their problem that they will have a mint, they will have a chewing gum, something, and they will do something or the other to camouflage the odor. Very rarely will you come across a smoker who doesn't take efforts to camouflage. Okay, and that's why many smokers who smoke at the sly generally smoke in the bathroom also. Okay, and then they will have a nice bathroom freshener inside. You know, so how do you detect whether the person in the house is smoking or not smoking? Presence of a special, you know, room freshener in the bathroom itself. Then alcoholics, people who drink definitely know that they have, you know, the mouth is stinking. So what do? Majority of the alcoholics don't talk only. They become very silent, and they don't open their mouth, because the moment they open their mouth, it stinks. So understand, alcohol also causes a lot of bad breath because it causes dryness of mouth. Smoking also major reason, dryness of mouth. So alcohol causes dryness of mouth, and that's why the bad breath or halitosis is experienced. Now we are all dentists. Okay, so any dental problem, primarily dental caries, or you have, you know, dry mouth, as I mentioned, dental abscesses, plaque, tartar, calculus, carious lesions, and to the matter, oral cancers. Any patient, you know, having any dental problem will definitely have halitosis. I mean, food lodgement in between the teeth also is a major cause of halitosis. So as dentists, we are very well aware that we are all having, I mean, a patient with a dental problem will definitely be having halitosis. Then we come to the medical side. Any medical conditions in which, you know, the patient might be suffering from bad breath? You know, most of us have sinus infection or cough or a cold. Now what happens in a cough and cold? Everybody take a deep breath. A person who has a cough and cold, when he takes a deep breath, a lot of mucus falls at the back of the tongue. What is this mucus loaded with? A lot of bacteria, and this bacteria reacts, and the byproduct is what? Volatile sulfur compounds. Then there are certain then there are certain disorders. For example, diabetes. A person who is diabetic definitely has malodor. Why? Because he has got ketone bodies. Okay, ketone odor is very typical of a diabetic person. And people who are hypertensive, the cardiac patients. See, because sometimes, as far as the medical condition is concerned, sometimes the medical condition by itself causes halitosis, or it is because of the medications they take. And most of the medications which they take, that is the antihistaminics or the anti-diabetics or the anti-hypertensive drugs, most of them cause dryness of mouth, and that's why there is severe halitosis. I mean, this is a basic reaction. A lot of anaerobic bacteria are present, and you know, a dry mouth further adds to this environment, and then it leads to the production of hydrogen sulfide and methyl mercaptan, that is the volatile sulfur compounds. Now, these compounds are dangerous. I mean, and these situations are dangerous. And who else can have bad breath? Teachers, people who are talking continuously, or people, or the call center executives who are sitting in though they are sitting in a nice AC cabin, they have a lot of dryness of mouth because they are talking. So any profession where you have to talk a lot, the marketing executives, anybody and everybody who talks a lot or is in a profession where he has to talk a lot, or he is a talkative person, will definitely be having dryness of mouth and halitosis. So now what happens in what is the connection between dry mouth and bad breath? Now saliva is very necessary to moisten and cleanse, okay, the mouth by neutralizing the acids produced by the plaque and washing away the dead cells that accumulate on the tongue, gums and cheeks. And if they aren't removed, the cell decompose and cause a lot of halitosis. Now what are the signs and symptoms of dry mouth? I mean, how do you know your mouth is dry? Very simple. There'll be difficulty in swallowing. There'll be difficulty in chewing. There'll be difficulty in there'll be difficulty in speaking. There'll be difficulty in chewing, and there will be a whitish coating on the tongue. The lips will be dry, and the taste will not be very good. Okay. Now, what are the various causes of dry mouth? I mean, the dental, as far as the most common cause is the prescription and non-prescription drugs. For example, the blood pressure medications, the antihistaminics, the antidepressants, the diuretics, the NSAIDs, okay, in dental infection. When you give a lot of antibiotics and analgesics, the patient's halitosis is definitely increased. It is primarily because of the increased dryness of mouth. Then there is depression, anxiety. See, many times when we are nervous, you know, we feel thirsty, we want to have water. Before a speech, for example, we want to have water. Okay. And of course, various allergies, like in allergies, you use a lot of antihistaminics and decongestants. And of course, in diarrhea, because there is loss of fluid. Now, any foods, many foods are there. I mean, and these are the most famous ones. The onions. Onions are rich in sulfur compounds. The garlic, fish and eggs. These are the prime culprits, you know, and we all know. I mean, you know, we don't have to tell. That's why they say, you know, that avoid onions or garlic, especially early in the morning. Okay, because and somehow, but what happens is that, say, for example, when you go to an Irani restaurant, okay, where, or you know, those typical breakfast joints where you have that bun maska, chai, omelette, what happens? Everybody is having the same product, so you can't recognize the stink. Then of course, milk products. Majority of milk products will cause, you know, bad breath. Okay, be your milk, lassi, chai, coffee, cheese, because all these products, see, remember, food lodgement. Okay, anything that gets stuck between your teeth, you know, once when you remove it with a floss and when you smell it, it stinks. And what happens is, these products which are there, they remain on the tongue. The tongue is a nice grassy surface, so it all remains over there. And if it remains for a longer period of time, the bacteria interact with the food debris and the production of volatile sulfur compounds takes place. Can stress cause bad breath? Yes, a lot of stress causes, because stress may one of the triggering components. It causes dryness of mouth. And what happens, person who's in stress or before an exam, what do? You tend to gorge on sweets, on chocolates, on ice cream. So these milk products definitely help in your halitosis. Now, basically, if we have to classify, okay, what are the different types? Because see, the management will be based on the type of bad breath which your patient is suffering from. Okay, the first thing is pathologic bad breath. Then there is something called as a transitory bad breath. And then there is something called as a physiologic bad breath. Okay, and there is something called as halitophobia. So these are the 4 categories of bad breath which we come across. Now, pathologic, it's very simple. If you have any dental pathology or if you have any medical pathology, you'll definitely be suffering from bad breath. And we discussed before in the causative factors of bad breath that which all condition, for example, a diabetic, an antihypertensive, a person who has got a severe cough and cold, or any dental and related problems, they'll definitely have the pathologic bad breath. Transitory bad breath, this is because of the foods that we consume, okay? And it lasts generally for 24 to 72 hours. Garlic is the most dangerous thing. I mean, we always tell everybody that, I mean, especially patients coming in for bad breath or halitosis management, garlic and onions have to be, you know, considerably controlled, because these are the, you know, these compounds are loaded with sulfur, and they will the moment you consume a garlic or, you know, an onion, your bad breath levels will be very high. And Indian food without garlic and onion is Is it there? Possible? Yes, only in the Jain section where they do not eat garlic, and so that particular group is saved of at least this food factor, or the food which is rich in volatile sulfur compounds. Then there is something called as physiologic bad breath. Now, how many of you all have a tongue? Many people? All of you all have, no? We all have tongue. Now, what is the speciality of the tongue? The tongue is an amazing structure. Like tongue you should never neglect, because tongue is like a lawn. Anything and everything you eat stays back on the tongue. Your ice cream will not get stuck between your tooth. A nice, coffee, tea will not get stuck in your tooth. It will stay on your tongue. And anything that remains on the tongue definitely causes a lot of malodor. So there is no major pathology attached. You don't have a tongue defect or you don't have a tongue disease, but the grassy surface of the tongue helps a lot of food to remain over there. And if the food remains there, and many times you don't notice, okay, we just don't think about it. We say, no, I didn't have this. I don't eat onions. I have not eaten this. I have not eaten that. But whatever you eat, because remember, the tongue is a very, very critical organ. Okay. The tongue occupies more space in the mouth than the teeth itself. So we as dentists should focus on the tongue a lot, especially in halitosis management. And of course, tongue is quite a troublesome organ also. Especially when we're doing the mandibular teeth, the tongue definitely troubles. That's why we love the maxillary teeth where there is no tongue. Different types of tongue. If the tongue has a nice white coating, a yellow coating, a green coating, be assured that you have halitosis. Then there is something called as halitophobia. Okay, now this halitophobia is generally very, very, like it happens in those patients who are suffering from bad breath. And in spite of they undergoing treatment also for halitosis, they get their oral prophylaxis done, they get their dental and medical stuff cleared, but they still feel that they have got halitosis. This especially happens, for example, I'll give you a very simple example. Like, you are a group of 10 people and you suddenly walk and you say hi to everybody. And then suddenly one person does like this. So what do you feel? Okay, maybe my mouth is stinking. That's why he is touched his nose. I might just feel scratchy, so I'm touching my nose. So that can be possible. So it is halitophobia. So halitophobia, how does it develop? If you are aware of a problem, okay, you feel that everybody is focusing on that problem only. Say, for example, a person who is losing his hair. What happens? Whenever he is out in the public, the moment anybody looks at him, he will do some adjustment on his hair. I mean, I might be looking at his eyes, I might be looking at his beard, I might be looking at his pen, watch, but his focus, because since he's suffering from alopecia, he feels that everybody's focus is on his hair only. So now the conclusion now is that 15 minutes back, most of you all said that we do not have bad breath. Yes. Now, is there a change in opinion? Because as I mentioned, everybody has a tongue. Okay. So the possibility of halitosis is definitely there. Each one of us suffers from bad breath. The issue is that the percentile or the level of bad breath might vary. Because since we have tongue, after we have had our meal, okay, if you don't clean your tongue and you don't brush your teeth, or after your tea or coffee, if you don't clean your tongue, you don't brush your teeth, you're definitely having halitosis. Okay, so each and every person is suffering from halitosis, only the quantum will vary. Now, there are a lot of myths about halitosis. Okay, some say acidity causes a lot of bad breath. Now, see, understand one thing, acidity is a feeling. You feel that burning sensation. There's no fire coming out from your mouth. Okay, then they say stomach problems. Yes, stomach problems. How? I mean, I fail to understand. If you have stomach issues, you might be constipated, you might have diarrhea. The area or the exit point is different. Okay. I mean, if you have had any stomach, the only problem which I can consider, any stomach problem which you can connect with halitosis is hiatus hernia. Now, what happens in hiatus hernia is that when you're having your food, the gastroesophageal sphincter which is there, the control is lost. So the moment you are eating food, the sphincter control is there and the food tends to pop out. So if there is severe regurgitation, okay, there will be definitely bad breath. And yeah, somebody mentioned diarrhea. Okay, see, diarrhea in the sense it causes dryness of mouth. So that we have discussed. So stomach problem like diarrhea, but not directly. It is in the diarrhea, loss of fluid, and that's why there is dryness of mouth. Okay. Then my next question is, how do you check your bad breath? I mean, how do you know that a person is suffering from bad breath? See, as a dentist, we can make it out very easily. Okay, we just have a look in the oral cavity. And since we are so close to the mouth, we definitely get to know the odor. But now suppose you want to tell your patient that how a layman can check whether he's got bad breath or no. How do you check that out? Okay, so many people suggested you blow air and you smell. How can you smell like that? You can't smell. Okay, you can't just blow and you can smell. So I just would like to show you the various methods of checking whether you have got halitosis or no. Now you check it out yourself. See, now we are all like on a webinar, so each one of you can actually check just now right away whether you've got halitosis or no. So the simplest method is lick your hand, lick your fingers, or lick your palm. What happens? And then wait for 30 seconds and smell. Whatever the odor is there is the bad breath that is there in your mouth. Or the other method is the Shah Rukh Khan style. Okay, you tell your partner to check, is any bad breath coming? He or she will tell yes or no. Or then have a look at your tongue. If there is a white coating on your tongue, or there is a yellowish coating on your tongue, or there is some sort of a coating on your tongue, be assured that you've got halitosis. And of course, you can use your floss. What happens when you use your floss? See, you just take your floss and remove the food debris and smell it. It stinks. That's the level of odor that is present in your mouth. See, what happens, there is an issue that we don't tell each other, okay, that he or she is suffering from halitosis. Try telling it to your partner. I mean, if you tell, for example, your wife, okay, you got a lot of bad breath, what will be the response? Okay, you smell worse. That is the obvious response, because your breath is so personal. People don't, talk about it so freely. And sometimes because we are in the same environment, we are having the same food, same diet, same oral hygiene practices. So whatever sting comes out, it is the same. Okay, so that's why, and since it's so personal, the opposing person feels very much offended. So today you can suggest these methods, okay, to your friends and relatives. Just have a look if you have bad breath or no. And then if they feel that they're having, they will definitely come back to you for treatment. Now, are there any scientific ways of checking halitosis? Yes, there is a halimeter. A halimeter is a scientific device, okay, which calculates or tells you the level of bad breath which is there. Okay, now various reading are there. This gadget comes, you ask just the patient to blow in this, and there will be readings coming. If 1 dot comes in, there is no odor. If 3 are there, slight odor. If 6 are there, moderate odor. And if a bunch of it is there, then there is strong odor. See, because the scientific evidence is always required. Okay, because you just can't by looking tell, okay, your hemoglobin is less. Then after 15 days, when you check somebody, now your hemoglobin looks better. What will that person tell you? Okay, why are you making a fool of me? Okay, so that's why we send him for a blood test, and then he comes, okay, when I started it, it was 7.4, and after your medication, it is 12.4. So definitely it's increased. So we need something quantitative, just not subjective. Okay, so if you are intending to start a fresh breath clinic, one of the devices that you need is a halimeter. Now, what is the treatment of bad breath? Is it very complicated for dentists? No, it is not. It is very, very simple. But the focus areas become different. The discussions are a little different. Okay. Now, before we get into the basics of tackling how do we manage bad breath, generally, how do most of the majority of crowd manages bad breath? Many of them will be brushing 2 times, 3 times, 4 times, and maybe 5 times a day. And I told you what happens by brushing 5 times a day, especially with a toothpaste which contains sodium lauryl sulfate. There'll be dryness of mouth and the halitosis continues. Then many people pop in a variety of mints and chewing gums and all that are there. Now, yeah, mouthwash, Namrata. Mouthwash is there, definitely. I'm coming to that. Mouthwash is in the schedule. We will be discussing that also. But generally, You know, people start like this. They have a lot of mints. Most of the ladies carry a lot of polos and all that. Now, remember, friends, most of the sugar products, all these mints are sugar based. So what happens when you have a sugar based chewing gum or a mint to manage your halitosis? You have given food for the bacteria multiply further and they release more volatile sulfur compounds. So what happens, you know, having these mints and chewing gums, you know, what exactly are you doing? You are just masking the odor. You know, you're just masking the odor. You're just feeling good about it. I mean, how can a mint help in curing bad breath? I mean, if it is loaded with silver, it's just a false feeling. It's like you have not had a bath for 7 days and you are putting perfume. Okay, so the pathology remains. 1 minute. So now management of bad breath. Now, if a patient comes to you with a complaint of halitosis, this is the schedule that I generally follow. We have a detailed intraoral and extraoral examination because the dental aspects are checked into. I mean, if there is an obvious gingival or periodontal disease, then an oral prophylaxis is a must. Then if there are missing teeth, we need to tackle that also. Okay. And if there is an abscess, RC treatment is required, or whatever dental, because see, any dental process in some way or the other leads to halitosis. For example, a small cavity, food lodgement. If there is bleeding from the gums, food lodgement, and all these things contribute to the bad breath. So a detailed intraoral and extraoral examination is done. And the next thing is medical history. Okay, the medical history is very critical. I mean, believe me, many times you can detect diabetes. Okay, diabetes just by the odor. Okay, because believe me, the moment you get into this fresh breath specialist, you know, aspect of dentistry, your nose becomes very powerful. Okay, and so if there is any medical history, you know, you have to check it out, because no matter, because see, many a time we just do a good oral prophylaxis and still the patient says that I've got a lot of bad breath. So you have to tackle the underlying medical condition. You have to refer him to a suitable specialist. Then bad breath testing is very important. You check the bad breath, and many a times you give the patient the bad breath tester itself, because see, sometimes, okay, the patient will tell that I feel that the bad breath is maximum at nights, at such hours, you know, where you may not be available. So give him the bad breath tester and he will report back. And the major component of bad breath testing is in bad breath management is diet counseling, because a lot of foods are there which are causing a lot of bad breath. You have a clean mouth, good oral hygiene methods, and where is the bad breath coming from? That counseling is very, very critical. And then the last aspect which we cannot neglect is the oral hygiene instructions. Boss, there is a lot of issues, a lot of misconceptions in people's minds, so we have to give them an idea about that also. Now, diet counseling, we all love buffets. Buffet is our favorite, okay? And any buffet, we have a starter, then you have a welcome drink, you have a starter, you have a main course, then you have a dessert, and then you end up with a pan. Now, understand one thing, somehow all of us, you know, have a habit of, you know, making healthy things unhealthy. Fruits are so healthy, but we convert them into fruit salads. Okay, many healthy things are converted into non-healthy items, you know, so that makes it dangerous. So what happens is, most of the time when the people are finishing their meals, the last thing they have dessert. And what is a dessert? It's basically a milk derivative, you know, an ice cream or a cake. And what happens? All that remains on the surface of your tongue. So that's why you stink in 10-15 minutes. So now what we have to suggest in the diet planning is you have to break the sequence. Okay. Now we have to tell people, okay, boss, fruit salads we have to avoid. Have fresh fruits at the end of your meal, boss. Because we have learned everywhere, fibrous fruits increase salivation and have a cleansing mechanism. Okay. But we don't practice. So the fruit which you're going to have after your meal is either a watermelon, okay, a muskmelon, grape, strawberry. They will definitely increase, you know, the fibrous content will help us to clear off the food debris. Okay, and this will help in the reduction in bad breath. I mean, I don't say a mango milkshake or a chiku milkshake will not help, because that will stay back. So breaking the sequence, the last thing that we should have is a nice fruit. And of course, this is a lovely video which I will show you at the end of it. Cucumber. Cucumber is the most amazing fruit, I can say, that I've ever come across, and has got a major role in management of halitosis. I have a lot of cucumber, boss. And I mean, if you can end your meal with cucumber, be assured your bad breath will be considerably less. I will show you the importance of cucumber at the end of my session with the video only. This guy has really taught me and made me fall in love with cucumber. Now understand one thing, medicine is not healthcare, food is healthcare, medicine is sick care. Now we have to get this right. A hospital is not a place, it is not a healthcare institute, it is a sick care institute. Okay. Now homemade remedies are definitely there. See, we are all Indians, and believe me, our Ayurveda, our history is rich in, stuff which can help in halitosis. I mean, fennel seeds, cinnamon, fenugreek, clove. The clove is such a wonderful thing. Believe me, your purse should have a small plastic sachet, and you should always pop in 8-10 cloves. And whenever you feel there is a stink coming from your mouth, just pop in one clove. Clove really takes care of bad breath. It's all these items whichever I've mentioned or shown in the figure, they really help in bad breath. Okay. Elaichi is also good. Okay, but not in the form of pan masala, yaar. Elaichi, the pure elaichi, one elaichi you place in your mouth and it takes care of your halitosis considerably. Now anybody can guess who is this guy? He's Amitabh Bachchan, and he's promoting pan. If you remember his song, Khai Ke Pan Banaras Wala. Okay, after that, anybody got into this concept and they got the idea of Banaras ka pan. Okay, so now pan again, is one of the components with which we end our food. Now, believe me, friends, pan is again a major cause of halitosis, because the original pan, see, our culture, pan was given to take care of halitosis only. Okay, the pan, the soft. But what did we do to the pan? We have magai meetha, we have dry fruit pan, we have ice cream pan. Okay, what have we done to the pan? And then we have the magai meetha. What do we do in the magai meetha? That guy dips it in the rose syrup and you have it. It's loaded with sugar. Okay, it's loaded with sugar. And then you pop it in your mouth and the sugar spreads everywhere and then your mouth stinks. So the pan which we were traditionally supposed to have was a sada pan. Okay, our ancestors are not fools. They proposed lovely pans. Chuna, katha and all that stuff was never supposed to be a part of the pan. Okay, but people kept on adding it for their taste. And that's how they, a good healthy derivative became a major cause of concern. So now, and of course, cold drinks. Cold drinks are amazing. Okay, and they contribute to a lot of dental problems and medical problems also. And if they cause a dental problem, so cold drinks, my dear friends, all your patients with halitosis will have to avoid. Tea. Can tea cause bad breath? Definitely tea can cause bad breath. See, tea was such a wonderful invention. Okay, it was one of the most beautiful invention. I mean, if you understand, tea leaves are rich, very rich in fluoride. But how have we jacked up the tea? We added milk, okay, and then we added sugar to it, okay, and then we drink it. Okay, nice boiling, may we drink it. And many a times we have the Irani chai, which is nothing less than basundi chai. Okay, and what does tea do? Okay, not only does it remain on your tongue, but it also stains the teeth. Okay, so people who are suffering from halitosis, we have to check about their tea activity also, and we have to ask them to reduce their tea intake, and we have to switch over to green tea. Believe me, friends, green tea is amazing. So many properties of it are there. It has got an antioxidant property, it boosts immunity, and you name it, and it has those properties. But we are not tuned in for healthy stuff. जब तक कोई चीज unhealthy नहीं होती, हमको उसका taste ही नहीं आता है. Okay, it's yeah, one Akshita also mentioned. Yes. Sorry, the screen blew up. So Akshita mentioned even the home remedies camouflage. Yeah, see, but it don't see the remedies. I mean, see, you have got your oral prophylaxis done. You've got all your dental treatment done. The mint which you place in your mouth, okay, contains a lot of sugar, and it increases the bad breath. But the medicine, the cinnamon, for example, they have the medicinal properties which helps to take care of bad breath. That is how it is. Then brushing, we need to brush 2 times a day. Okay, twice a day brushing is definitely recommended, and the correct technique has to be taught as to how you have to brush your teeth. Now we come to the topic of toothpaste. I started with the toothpaste, and we'll discuss toothpaste a little bit in detail. See, now the whole idea is that we're not telling that this toothpaste is good or this toothpaste is bad. No, we should know the ingredients, and I am concerned about the toothpaste which I will recommend for halitosis. Okay, that is my main concern. Now, we have all seen toothpaste. We have to check out for the black marks, the blue marks, the green marks, the red marks. Green is natural, blue is natural for medicine. So in my last session, last part, where I will be showing you the video, I will be showing you all these things. Also, we need to be aware as dentists that these are the different types. Now, understand one thing. When you are prescribing a toothpaste for a patient with halitosis, where halitosis is the chief complaint, you have to, these are some of the toothpaste which contain a lot of alcohol. So alcohol, as I told you, is a dryness agent, and it causes dryness of mouth. So it'll further enhance the halitosis. Then you come across certain toothpaste which contain nicotine also. Wow. Can you believe that there are toothpaste which contain some amount of nicotine? So nicotine here we are not recommending, okay? Not at all. So these are some of the toothpaste that we bumped into, and they found one of the constituents that they contain nicotine. These are some of the powders which they contain nicotine. And then these are some of the toothpaste with alcohol and tobacco, both. That is nicotine. Like, wow, this cannot be recommended for halitosis at all. Because as we have discussed earlier, tobacco, alcohol cannot be recommended. Then these are some of the toothpaste which do not contain alcohol. So you can think about it. But my worry again is the sodium lauryl sulfate. What do I do about my sodium lauryl sulfate? I mean, do we have any toothpaste which do not contain sodium lauryl sulfate? So now for halitosis, we need a toothpaste that doesn't contain alcohol, that doesn't contain sodium lauryl sulfate, and it doesn't contain nicotine also. So this is the properties which we are looking at. Are such toothpaste available? Yes, there are. And then of course we have some toothpaste which contain fluorides. So when you are looking at the anti-caries activity, these are the best toothpaste to recommend. Okay. Then I just made a chart. I mean, just for convenience. Okay, there are some alcohol containing toothpaste, and there are alcohol-free toothpastes. Okay. And the phenolene F has not to be taken into consideration because it does contain alcohol and nicotine. So you have the other toothpaste. So what I realized that the toothpaste which are used for sensitivity technically do not contain sodium lauryl sulfate. So you may recommend a toothpaste like this. It might definitely help. There's no harm. Okay, there's no harm because at least the dryness of mouth will not be felt after you have brushed with this particular toothpaste. Now you might feel, is it possible? Try it out. Just pick up one of these, brush, and you see. And you do your own comparison. Your normal toothpaste which contains sodium lauryl sulfate, there'll definitely be dryness of mouth. But in this toothpaste, there'll be no dryness in mouth. Now, this is one more aspect I will show you, and I'll be discussing about toothpaste, a very beautiful video which I'll be discussing towards the end of my presentation. This is also about the plastic aspect of toothbrushes, because toothbrushes are an amazing thing, and we need to discuss them in detail too. And I'm a great fan of bamboo toothbrushes, but there is a little bit of issue there also. So, I have not yet landed up with the ideal toothbrush, but I'm always in the search for that. And tongue cleaning is a very, very critical exercise. I mean, how many of you all genuinely clean your tongue? Any answers? Everybody cleaning, and does anybody recommend tongue cleaners to your patients? How many of you all have recommended a tongue cleaner for your patients? Very good. Dr. Sadanan, you recommend? That's nice. Any specific brand that you recommend as far as the tongue cleaner is concerned? Mayol, very good. I'm so glad because tongue cleaning, again, it's a traditional Indian habit. Do you know that? It's all Indian. It's a traditional Indian habit followed from thousands of years. Believe me. I mean, we are rich in our history. I mean, the kind of products which we have, we are at I mean, we are far ahead of everybody. We are just amazing, guys. We are just amazing. Okay. So tongue cleaning is very, very critical because tongue occupies a major portion in the oral cavity and it is the main cause of bad breath, boss. I mean, how much, how much area does a tooth occupy in the mouth? It is the tongue. So variety of tongue cleaners are available and, you need to clean your tongue. Of course, one Hussein Barmawala is telling me about electronic. Yes, electronic brushes are very good, no doubt about it. And you need to, any advances are always welcome. And when do you clean your tongue is the biggest question which I always, just a second, I'll just have a little water because now I have got dryness of mouth. Yeah, Dr. Mustafa is mentioning the back side of the toothbrush. Yes, some of the toothbrush do have, but if you look at the size of the back side of the toothbrush and our tongue, the size is quite big. So I need a tongue cleaner which covers almost the entire surface of my tongue. Okay, and of course, Dr. Prabhakar sir is telling about the plastic tongue cleaner. What exactly it is? Yes, a plastic tongue cleaner is definitely of great use, and this is the tongue. But when we should clean our tongues? See, understand one thing. When you get up in the morning, see what happens is, okay, most of the time when we get up in the morning, the first thing that we want to do is brush our teeth, clean our mouth. We don't feel like talking or chatting because our mouth is stinking. Now, why is that? Okay, because over a long period, the mouth has been quite dry. And as I told you, dryness of mouth is a major cause of bad breath. So now what you should do, once you have got up, you brush your teeth, you clean your tongue, and the next thing you have your breakfast. After you have had your breakfast, before you leave for your work, please clean your tongue. Otherwise, your tea, coffee, cheese, butter will remain on your tongue and there will be severe halitosis. So cleaning of your tongue is very critical after every meal. See, it's not easy. It is not, sometimes people say it's not practical, but cleaning of brushing is impractical because you require a toothpaste, you require a brush, and you require everything. But for cleaning of your tongue, you just have to go and just clean your tongue. So I always, whenever I give tongue cleaners to my patients, I give almost 6 of them. One for home, one for traveling, 2 for office, and 2 for spare. Tongue cleaners have to be carried everywhere. Okay. And in the night today, clean your tongue with a good quality tongue cleaner and you see the effect. The amount of sting that will come in the morning will be considerably less. And of course, you have to floss after every meals. Okay, that goes because anything that remains in the mouth will definitely cause a lot of halitosis. So that needs to be taken care of. And of course, one person mentioned, that mouthwashes play a very important role. Yes, but which kind of mouthwash? Okay. Now, from my lecture, you understood that alcohol containing mouthwashes will not help. They have beautiful properties for other ailments, for gingival, periodontal. We are not discussing that over here. We are discussing about halitosis. So an alcohol containing mouthwash will cause dryness of mouth. And what will be there? As somebody mentioned, from Redmi to everyone, alcohol-free mouthwashes. Yes. So even Listerine Zero is available. Okay. Colgate Flux is there. So before you prescribe a mouthwash or before, my dear friends, you pick up a mouthwash, check for the content. I'm not here to promote any particular mouthwash, but pick up a mouthwash which doesn't contain alcohol. Okay, because alcohol causes dryness of mouth and it causes the main cause of halitosis. Hyora, yes, definitely. See the herbal mouthwashes. Again, I tell you, Indian products, I'm a great fan of them. They definitely will do well. And I have bumped into this lovely mouthwash. The content surprised me and I fell for it. The herbal mouthwash which I bumped into was by a company by Amarantha. You may have heard about it or may not. But it's a herbal mouthwash and contains lavanga, clove oil. Do we have to discuss about clove? Triphala extract. Then you have Gandhapura oil and Nimba extracts, which is, neem. So all these neem, tulsi and all that is known. So herbal products are definitely good. And, If we look for it, we will find, but somehow we will not be interested. We look out for things which are more flashy. Now, as far as dryness of mouth is concerned, like many people say very easily, drink a lot of water, drink a lot of water. Now you're working in an office here. And you're in an AC office, you're a call center executive, you're talking, and you say, sir, I attended your lecture, so I'm drinking a lot of water. So what happens if you drink a lot of water? Every time, every 1 hour, you will have to go. So finally, what will happen? Your boss will give you a place near the bathroom only. Baba, you sit there or you wear a pamper and you come. You can't do that, right? So whenever there is dryness in your mouth, just have a sip of water. A sip is enough to take care of your dryness. And then we have a lovely product by the name of Miswak. Miswak is definitely there, but we don't like it. Miswak is there in India and it has been recommended by the Prophet thousands of years ago. But the brush came in. We Indians were using the brush way much, thousands of years before anybody got in touch with it. And it definitely helps. But I have a modification. I mean, you are working in a high-tech hospital, or you're working in a hi-fi company, or you're a big guy. So you don't want to carry that neem stick with you. Okay, so what do? There is something called as a handle-free brush, which is a chew brush. I will definitely be showing you the chew brush in my live demo. So this brush is a handle-free brush and it contains xylitol, sorbitol, and some natural flavors. You just pop it in your mouth, chew it for a minute. When you chew it for a minute, what happens? There is increase in your salivation and there is decrease in your halitosis. And of course, I'm a great fan of chewing gums. See, chewing gums take care of your halitosis considerably. But you have to use the sugar-free ones, my dear friends, because if you take a sugar-containing chewing gum, what will happen? You will spread the sugar all around in your mouth and you will provide food for the bacteria. Oh, my voice is breaking. Now is it clear? Is it clear now? Is it clear? Okay, thank you. So you have to have a sugar-free chewing gum, and believe me, my friends, you have to chew the chewing gum only for 2 minutes. 2 minutes is the time for which, the duration for which you have to chew your gums. Because if you chew your chewing gum like a cow, like that, what will be the result? There will be dryness of mouth and there will be severe halitosis. So even a sugar-free chewing gum, there is a technique of using it, okay? And then we Indians are the most, the greatest fans of turmeric, and turmeric is amazing. Believe me, we have turmeric in all forms. We use it as a skin. We use it for our skin. We use an antiseptic. We use for teeth whitening. If you have a cough and cold, what do you use? Haldi doodh, haldi pani. Haldi is in our system. It's in our food. Okay. So how can turmeric help in bad breath? Can it? Yes. Now, what is the main ingredient of turmeric? It contains curcumin, which inhibits the growth of microorganisms. It kills, or it is a bactericidal effect. It prevents further development of colonization of bacteria. And it prevents plaque formation and it treats inflammation of the gums. So many things which are leading or helping in halitosis are taken care by curcumin. So I landed up with this haldi mint. Believe me, it is one of the best mints that I've ever come across in my life. The sugar-free mints are great. But this haldi mint, you get that Indian feeling. It's a lovely product. So now what I recommend to my patient is my lovely fresh breath kit. Okay, now what I've given that kit to my patients, of course, understand one thing, the medical aspect is, inform to the patient. Then the dental aspect, we take care of it. But you need to give a specific kit, okay, because it's required. You just can't tell a patient, go use this tongue cleaner or use this, No. You should be able to tell what is good or what is bad. So in my fresh breath kit, I have a lovely herbal mouthwash. I have a handle-free chew brush. I give tongue cleaners a dime a dozen because they really help. I even have a pediatric tongue cleaner. And of course, I give mints. And then we follow them up after every month. And believe me, in a month or two, the halitosis is taken care of. And of course, the dietary counseling is very, very important. So this is how my kit looks. It's wonderful. And I don't say you pick up my kit or you buy my kit. Okay. But you can definitely design your own kits, because I've given you the content that you need this type of mouthwashes, you need this type of a toothpaste, you need this kind of brushes, everything is there. So you can create your own kits. Now, this is more or less end of a part of my webinar. So how did you like my idea, friends, of Fresh Breath Clinic? I mean, any responses from your side? Hope you got a little idea as to how to manage a bad breath patient. Okay. So now I don't say this is the end, this is the beginning, and it is a paradigm shift. Okay. Now, this is for the slide part. I'm saying thank you, not for the live demo. So stay tuned. I've got still a lot of content remaining. So I'll not leave you so early. So I thank you, ID MSWB, for giving me such a lovely platform. And a very special thanks to my team at Rangunwala Dental College. Okay, I am professor and head at MA Rangunwala Dental College. So I'm always thankful to all my wonderful staff and all my postgraduate students who have really helped me working, they've helped me in all the research. Okay. And of course, and we always like to click photographs during the culturals because we all look so good. Okay. And this is my contact number and email. Any query, anytime, you just put in a message and I'll be there. And now I will require a minute, because now I'll be going to my live demonstration of all the products that I spoke about. Now I'll be showing you one by one. So please don't leave. Just give me a second and I'll be with you now. Just call Hussein and this to take my video. Just give me a moment, please. Now I'll just run through the products which I'm going to discuss. Now I'll just hand over the camera to my son, so he'll be shooting me. Friends, am I visible now? So this is the pocket halimeter which I was talking about.
Dr. Jashan?
Yes?
Sir, just a minute. Dr. Jashan, can you make Dr. Yusuf Chunawala on the full screen, please?
Am I visible now?
Yes, sir.
So can everybody see the pocket halimeter? Is it visible?
Yes, sir, it's visible.
Okay, so this is the pocket halimeter. This is how it works. And you blow the air in it and it gives the results. Can you see those multiple dots?
Yeah.
I've got severe halitosis. I've been talking for over an hour, and even though I took a little bit of water, but still that half an hour was still gap. So in half an hour also so much bad breath is created. So you need to pick up, if you want to start a fresh breath clinic or you want to check your bad breath, you need to have this pocket halimeter with you. And now you'll tell me where it is available. Just go on Google and it will help you out. And then we come across a variety of tongue cleaners. See, saw this tongue cleaner? A lovely plastic tongue cleaner. And you clean it nicely and then wash it back. Then something like this is also available. This looks have a razor-like effect, but it works. And then you have a similar one. And of course, this kind is also there. Can you see this? It's wonderful. It just goes inside and all the debris, see, it has got a little bit rough edges over here. So it collects all the debris and you just throw it out. And then you have a metal one, okay? Now see, understand one thing, please don't pick up the 10 rupees, 20 rupees, one wala tongue cleaner from your banya. Because what kind of steel is he going to give you in that? He gives you patra, aluminium, and it will not help at all. Okay, so understand one thing, a good quality tongue cleaner is needed by you yourself and recommended also. Now this is a tongue cleaner which I really love. This was made by one of my friends, Mr. Dr. Hemant Thakur helped me design this particular tongue cleaner. See now the beauty of this tongue cleaner that it has got a thumb grip, so you know where to hold. I mean, most of the other tongue cleaners, you don't know where to hold it from. Should I hold it like this, like this, like this, or like this? Here it has got, so this is how you hold it, and then you place it in your mouth and flush out the debris. See, it has got a nice concave surface which collects the food debris and it throws it out. Different colors are definitely available, and you have, this is how it is packaged. Wonderful tongue cleaner. I don't say use this, but get yourself a very good tongue cleaner. Then somebody mentioned about brushes, right? Okay, and they said use the back of this. Now just tell me, my dear friends, what is advisable, a tongue cleaner or a back of your brush? How this will help? This will just, and many people use the brush. Okay, how will it help? It just removes the debris from one side and it loads it in your sulcus or below your tongue. So it doesn't help at all. And then brushes. You have to be careful. See, look at this hollow part. Can you see the hollow part? These are the cheap brushes, my dear friend. I mean, when you are prescribing, prescribe the best for your patients, not 10 rupees and 12 rupee wala brushes. Never, because many people have a habit of picking up the freebies. You going to a mall, you buy a bucket. With the bucket, you get a toothpaste and a toothbrush. Don't pick up such stuff. Then we come to our toothpaste part. See, remember those lines which I was talking about? The black, the blue, the green, okay? And all these toothpastes, okay? As a dentist, it is mandatory for you to know the composition of that. So today's exercise, please pull in all your toothpaste and check which ones you're using and then recommend accordingly. And then we have this lovely mouthwash which I bumped into. Okay, this is the herbal mouthwash by Amarantha. It's really doing well. And then my friends, remember this chew brush which I showed you. See, this is how the brush is. A small brush. The method of using it is very simple. You just place it in your mouth. Just chew it. Very good. You have to chew it. And by chewing it, what happened? Should I spit? See, saliva has increased. So your halitosis is taken care of. Now, generally, this is, and all these products are available, my dear friend. It's called as a chew brush. Just check on the internet and you'll be able to catch hold of it. And this is, of course, the miswak. Many people, will not want to give the me maja jhadachi fandi kasa kai patient la du. So these kind of stuff is also available. Give it to your patient. The natural products have their own use. Then I was talking about curcumint. Okay, this is the mint I'm heavily recommending to all my patients because it contains curcumint, haldi, and it is a sugar-free mint and it definitely works amazing. Okay, I don't say again that you check out on your net. Are there any such products available and compile your own kit. Now, after this, I'll just show you how my kit looks. Isn't it amazing? I mean, the patients really love this kit. Okay. All angles. And of course, the back part, there is the mouthwash. It has got the mouthwash, it has got the mints, it has got the chew brush, it's got the chewing gum, and it's got the tongue cleaner also. Now comes the brush, the bamboo brush. Lovely. But there is a little bit of controversy regarding to these bamboo brushes. I mean, if they are stored in a moist environment, will anything happen? So you need to be a little careful. But bamboo brush is the future. Now, my simple question to all of you all, my dear friends, what are these? These are empty boxes, right? Are they of any use? I've been, like I got motivated to promote this cause. And why do the toothpaste companies need to make this? Okay, this is all paper and plastic. So much waste has been created all the world over. I mean, so I'll just now share some videos, with you, which I told you that we have 2-3 videos also remaining, which I need to share with you also. I'll just show you videos that these things are not required. Now, just give me a minute. I'll be switching on to my video.
Okay, there are 2 questions.
Okay.
One is the cheap brush a one-time use or reusable?
My dear friends, it's quite an expensive commodity. Okay, so you need to wash it and reuse it again. Yeah.
Also, another question, what is the controversy behind the bamboo brush was the question.
the bamboo brush, many people see there are the people who are against plastic say that it is the most amazing thing, but there is an issue that that if it is kept in a moist environment, will the bamboo attract a lot of food bacteria for a lot of bacteria and fungi? So, that's why there are two schools of thought regarding the bamboo brush. Now, one thing I need to tell you that as far as these brushes are concerned, I mean, world over, they are thrown away very easily, but we are using, I mean, of course, if you ask that we're using it for a very long time, I mean, here we are using this brush at least for 3 to 6 months to brush our teeth. Then after that, do we throw this away? No. Then we use it for brushing our shoes and all that. Okay. And once that is over, we break the head and then this becomes the nada dandi. If you remember, people who wear pajamas, they use it as a nada dandi. So we don't dispose this off so easily, but still, we need to look at healthier alternatives. So now I will just show you some videos okay, are there any more questions?
So there's one question. How do you ask your child to clean their tongue?
See, the children, if he is below 7 years of age, you have to clean your tongue yourself. I mean, you have to help your child clean the tongue. I mean, baby tongue cleaners are available. Just a second, I'll be going on to the videos. Now, friends, this is about the bamboo toothbrush which I was talking about.
Every day. But did you ever consider the environmental impact caused by your toothbrush? The plastic toothbrush is not biodegradable, and neither is the plastic packaging. Plastic comes from oil. That's a fossil fuel. There is nothing in nature that biodegrades plastic. Even recycling is not a solution because our recycling facilities cannot keep up with new plastic production. The truth is that only 8% of what goes into the recycling bin is actually recycled. All of the plastic toothbrushes you've ever used in this lifetime still exist. In fact, all of the plastic toothbrushes created since the invention of the plastic toothbrush in the 1930s still exist. Billions of plastic toothbrushes end up in our landfills and our waterways every year. Quit plastic. Brush with bamboo.
Friends, this was the video on the bamboo brushes. Now, I spoke about the boxes.
Hi, I have a question, and I want to do something about this. Why does toothpaste come in a box? This product is used by 2/3 of the world's population on a daily basis. The box makes it more expensive for the makers and for the buyers. And the only thing we do with it is to throw it away. Then why? What's the point?
Because it looks better.
That's right. And every year, 900 million useless boxes are produced only in the United States. So the question is, who can change this? Politicians? Corporations? Well, there's one place where this is done differently. And that place is
Iceland!
Iceland. Iceland is the second most environmentally friendly country in the world. And in this small island, 90% of toothpaste tubes come without a box. But it wasn't always like that. Icelandic people made a drastic change in the way they consume and treat waste.
Because of the animals.
Because of global warming.
So are we safe?
So we won't die.
So we have a planet to live on because we only have one.
And this new consumer behavior forced politicians and corporations to make changes, including toothpaste with no boxes. Which means that the answer to who can change this is you and me. So, step 1, buy only toothpaste that comes without the box. I know it's hard, but if we all do it, it will change. So stick to it. Step 2, Tag on this video anybody you know that works in the government or in the toothpaste industry. Step 3. Spread the word. Share this information so that in 1 year from now, we can see this everywhere around the world. Sometimes it feels like we live in a society that it's out of our control. But the truth is that big changes start with ideas. Here's an idea. Let's get rid of this. Are you in?
Now, friends, the
Cucumber.
last
Or they
video
call
on
it in
cucumber.
Jamaica, cucumber. Cucumber. Vitamins, minerals, very high number, silica, hair and nails get longer. Other vitamins make your bones them stronger. Anti-wrinkle make you look younger. 95% water, kidney cleanser, great hydrator, detox fiber, good regulator. Your body good things, don't be a traitor. Get the cucumber, cut it in a slice, put it in a jug of water overnight. You know what you get for a fraction of the price? Energy drink full of electrolyte. Roaring salad is one of the user as a base for your vegetable juice. Another surprise, put a slice on your eyes, take away the dryness, revitalize. Oh yes. One thing I have left, cucumber can also help with bad breath. Wash away the bacteria that cause the odor. Cucumber water instead of soda. A Maccabea Medical Monday. Cucumber.
Hi, everybody. Hello. Hello.
Yes, sir, you're audible.
Yes, now this was the last part of my presentation, and at the end I would just like to say one more thing, that I'm really grateful to you.
Your voice is not audible, sir, now. Your voice is not audible.
I'm thankful to all the guys at the MWSB for giving me this opportunity to be with you all for a good 4 hours. So my, parting words would be that stay at home, stay safe. And because, we are part of a very historical event, because it's the first time in history that the month of April has 30 Sundays. Can you beat that? 30 Sundays are there in April. So
Amazing.
now take great care of yourself. Take a lot of selfies, take a lot of videos, because we are part of history. So we should have proof, and we should be able to show and tell people, see, this is what we did. And this is what all we faced. And if you have any questions, please definitely you can ask me now also or later also. And like all of you all should keep on praying that our Wi-Fi and networks remain intact and we get over this corona thing as soon as possible. Thank you.
Are you asking about Wi-Fi with W-I-F-I or W-I-F-E?
Whatever you consider, sir. Because it's been a wonderful experience. I mean, I'm telling you very honestly, I'm grateful that to all of you all, because now I'm motivated. Now I'll see to it that I'll trouble all the ideas all over India that you call, now you invite me for an webinar. Now you have to start recommending me left, right, and center. Because I mean, I'm so glad, and you all guys were so patient, and I could very easily, slowly, and steadily, talk about this, and thank you for being such a nice audience. Thank you very much.
So this webinar lecture is going to be going on all the Maharashtra state groups of IDA MWSB of Indian Dental Association, and also the head office branch of Indian Dental Association. And this is going to be shared on our YouTube channel also.
Oh, that means nobody will call me. They will hear me directly there only. Yeah.
No way, sir. Sir, the only problem with YouTube channel is they won't be able to ask you questions. The advantage of live,
very good experience.
Yeah, the advantage of live session is that they can clear their doubts immediately during the session itself.
Okay.
Yeah, Dr. Jashan.
Yes, sir. I don't.
Sir. Yusuf,
yes.
Sir. See, there
yes,
is
tell me.
One comment has come from Mr. Hussein Barmawala. Even London sharing it with my friends. Your YouTube is in London also.
He's my nephew only, actually.
Yeah.
yes. Because because his dad was an oral surgeon, Dr. Mustafa Barmawala from Naya Dental only. He was very nice oral surgeon,
Superb, superb.
And Hussein himself has a very nice lab in London, and he's doing amazing prosthetic and implant work. Very nice guy.
Dr. Jashan,
Yes, sir.
then can you just get in contact with Yusuf sir and his nephew over there, so we can have a talk on laboratories, work in the laboratories for the general dentist, to explain them how is the
Yes.
CAD-CAM done. How is the
Yes, sir.
CAD-CAM
Yes, sir. I'll get in touch with him.
Yeah, please. Yeah, just some
Well,
questions.
questions तो sir नहीं दिख रहे as such. Just going through it because we had covered 2 to 3 questions in between as well.
So there's a question as the cost of the helimeter.
Actually, I think not more than, it's less than 5,000 here, and it is available very easily. I mean, you have to just go on Google, and it's very easily available. Actually, you have to just order. But now, because of this lockdown, it will be a little hassle. But later on, it will be definitely be available.
Okay.
And it really works. It's a small device. Previously, we had a very big halimeter, which was quite a task to maintain. This is simple. I have almost for myself only. I have a dozen of them. Because in all my bags, car, everywhere I'm carrying, because I'm, like bad breath is my favorite topic. More than pedodontics, I am a fan of bad breath.
Okay. So in fact, I think so today's lecture, everybody has understood whatever you have spoke from your mouth, because there are no questions seen into these things, into the group chat.
Yeah, there are two. See, when no question comes, now the worry is that many of them might have gone to sleep also. Yeah, that is also there. No? ऐसा तो नहीं हुआ रहेगा ना?
No, sir, but reports are telling thank you, great words, thank you, sir, great session, a superb session, enjoyed it. You freshly opened our minds, and not
so
just
much.
our fresh breath. This is a good comment,
These are
sir.
yes, sir. These are the comments which are coming.
Yes, for kids, you have the Kedodent, you have the Colgate Kids. All these toothpastes are definitely there. What I always suggest that buy expensive and branded stuff. Because cheap stuff now is something which I hate as far as the oral health products are concerned. Because at 10 rupees and 12 rupees, what quality of brush are you getting? But we have to slowly educate कि Baba, use good quality because you're using it for yourself. I mean, something is going in your mouth. And like those ek ke upar ek free and all that stuff, you should never purchase. And reading the ingredients is very critical, because somehow now we don't have the habit of reading the ingredients only. Even the dentist, many a time just prescribe the toothpaste very randomly. I mean, you ask and understand what are the properties of each and every product, and then give accordingly. Then it helps, really helps. And for halitosis, believe me, all our sensitive care toothpaste now work wonders because they do not contain sodium lauryl sulfate. No? So you don't have to go abroad to pick up stuff. Everything is available here only, but we have never researched it. That is the problem.
Yeah.
So we have a request from one of the patients who is asking if you can please send the videos of the plastic and the bamboo tooth.
Yeah, that is on YouTube actually. But Dr. Jashin, I'll share you the link also. No problem. I have that link. See, now one question is about a design. See, design and all is, you have to see the efficacy. Like what we do generally is that if you want to see how good or bad is a toothbrush, is that this practice is not done regularly. But what you have to do is that you have to apply disclosing agent and ask the patient, teach the patient to brush. And then you give him 2-3 different types of toothbrushes, and then slowly you will get to see the efficacy of different toothbrushes. Using the disclosing agent before brushing is very, very critical. And after brushing, to evaluate how good it was. That is, but this habit of using disclosing agents is not there only. Even in oral prophylaxis, many times we just check, do we actually apply the disclosing agent by all the plaque has come out or no? We rarely do that because we don't have time. And somebody spoke about the water flosser. It is amazing. I mean, the flush of water, and it's like a 3-way syringe. It definitely works a lot. It really works very nicely. Yes. Any more questions? What are the disclosing agents? Yeah, disclosing agents are be toluidine or all this. They're very routinely available. Most of the perio departments always have it, and you just have to go on Google and you get the important the brand names which are available country wise, and you can just pick it up. Okay, and you have to use it yourself. Should we tell expensive or any, sir? I mean, this is in reference to what? See Patanjali, see, that's what I told you now. Even Patanjali, Colgate, or any company, you go through the ingredients. Does it serve your purpose? See, for my bad breath, I want a toothpaste which doesn't have sodium lauryl sulfate, doesn't have alcohol, okay, doesn't have nicotine. I'm happy with it. For me, the content is important rather than the brand. The content is correct, then I will look at, Baba, is it a good company? That's how we prescribe.
So
And there was one more.
Yeah, so I think so. Which brand is not important? The content which you use is more important, and what you require. What you require.
It is requirement, na? Yeah. It is as per the requirement. Why should we endorse any company unnecessarily? I mean, all are good only. They have put in a lot of work. I mean, what a lot of effort in creating a product. So we can always suggest to them, sir, can you add this component? Can you remove this component? Because we are the scientific persons. But unfortunately, we only don't know much. So whatever they give, we prescribe. And as I told you now, the flavoring agents make them so nice and fresh, mint flavor. Now, suppose if your patient tells that I'm allergic to mint, what recommendation will you give him? But then you'll have to actually give him a kid's toothpaste or the meswak, because meswak has the soft flavor. Or you give him a kid's toothpaste which has bubblegum flavor. So there are patients who come who are not allergic to mint or who don't like mint. So if you are not aware, then you will tell him, how will you manage? That is what. So information should be there with the doctor more. He should recommend. We should not leave it to the pharmacist. Pharmacist, you should just take our prescription. He should not be the recommending authority. Because, in India somehow, it is the other way around. The pharmacist only recommend. And sometimes only those brands are available which, are giving more margins at times. So that aspect. But if you put in a regular demand, the company and the store will definitely keep it because they want sales. No? That's what it is there. So I am very strict when I prescribe a toothpaste. But you have to use this only, procure it. Now there's a question, how many days a toothbrush lasts? 3 months generally. 3 to 4 months, it has to be discarded. But as you know, we can use it for multi-purpose over here. So it's all your personal choice whether you want to discard. And the bamboo brush definitely has potential, and we are planning soon, once this COVID gets over, we are going to do a few studies in relation with the bamboo brush. And one thing which I forgot to mention, that the toothbrush which you have should never be left open in your bathroom. It should have that head covering or it should be kept in a tube, because if it is left open, it is open to all the bacteria that are roaming around in the air in the bathroom, and especially people whose WC and bathroom is combined. So then you don't know what bacteria is resting on your toothbrush.
Yeah, sir. Friends, Dr. Yusuf sir is going to be there today till 9 o'clock to answer your more queries. And he'll share us the link for whatever videos you have asked for. Thanks, Dr. Yusuf sir.
Most welcome, most welcome.
It was really great to listen to you, because you're not away just the negativity which was there regarding bad breath has been removed, but also you have opened up the fresh breath from our mouth, and minds have been also become fresh now.
Yes,
regarding halitosis.
I mean, see, this is the time to actually revive, and I'm so glad so many webinars are going, because I myself am attending 1 or 2 webinars with so many things you learn. See, because every speaker has something to offer. And so many points I am noting down only, means I am desperate now to get into practice, because so many new things I have come across.
So yours is the 22nd webinar which we have organized. Yours is the 22nd webinar.
Amazing, amazing. Yeah, very nice.
Friends, tomorrow we have Dr. Satish Iyer speaking on pulp therapies in primary teeth. One more great topic, and I hope I'm sure we are going to have plenty of doubts in that, because kids' teeth are really going to be a challenge for us to treat. Even the pediatricians also have that challenge to treat those. Sir, do you agree with that?
Yeah. But see, I always follow a very simple concept. I was taught any non-vital pedo tooth, just remove it.
Okay. So great. So we invite you also. We invite.
Pardon, sir.
Yes, sir. Speak.
I've been taught so simple. Non-vital abscess tooth, remove it. If it is pulpectomy, has to be single visit or not at all. That's what, and then that gives the best result. I work on such, so that's why for me endo is very simple. The moment I see an abscess, the recommendation is extraction followed by a space maintenance.
Great.
There is 100% removal of infection. There is no recurrent visits by the patient, and the patients go very happy. And the space maintainer you make, and the child is happy. Of course, there will be always two schools of thoughts. So this is my school of thought. We are not challenging Baba. If you want to do abscess tooth, I showed you the method also LSTR. There also I don't want to put the instrument inside. Look forward for shortcuts. Yeah, how
So-
to comfortable. That is always
Right. So we request you to please attend tomorrow's webinar because it's on your second school of thought, I suppose, to save the primary teeth.
fun. It will be fun. Just send me the link. I'll be there, yeah, 100%.
Yeah, sure, sir. Sure.
More questions, believe me, the older I'm getting, I'm becoming more inquisitive.
So friends, thanks a lot once again. Do this videos, webinars are live, are available on YouTube channel of IDA MWSB. Please visit the channel, like, share, and subscribe. There are the previous webinars also, and we have 2 or 3 beautiful videos regarding COVID-19. We have our branch members have created a small video to spread the knowledge of stay home, stay alive, stay home, stay safe videos. And also we have a small video on tobacco awareness kit. The members of the branch have conducted a skit which was played on the roadsides of Malad East. Do go and visit, share, and like the channel. Thank you. Dr. Jashan, can you please end the meeting with the final words? Dr. Jashan?
Hello.
Yeah, Dr. Jashan.
Yep. Thank you once again, Dr. Yusuf, sir.
Yeah, most welcome, most
Yeah,
welcome.
and as Dr. Viraj says, our minds have become more fresher than the breath, because that is the most important thing as of now. Our minds were corrupted with coronaviruses, and with your lectures, it has now been free. So we can focus on different things. And thank you for a fantastic lecture. See you all again tomorrow at 3:30 for a lecture on pulp root canal of pulp primary teeth by Dr. Satish Iyer. Thank you. We'll be
By the
ending-
way, Dr. Satish Iyer is my student only.
Oh wow!
So then we need
Yes,
you tomorrow
yes.
then, sir. We need you
And
tomorrow
we
then.
share the same birth date also. He's also 4th May. I am also 4th May.
Fantastic. 4th में को फिर खुल रहा है सब, लॉकडाउन ओपन हो जाएगा सर.
Yes, yeah, hopefully, yeah.
Sir,
Chalo,
birthday
bye,
gift
bye.
मिलेगा. Sir, birthday gift मिलेगा आपको.
Yes,
Yes,
sir.
yes.
Clinics पे वापस जाने को.
Yes. Chalo, thanks a lot, Jashan.
Okay,
Thanks
thank
a
you.
lot.
Thank you,
Yes,
sir.
yes,
Thank
Dr.
you.
Viraj, thank you so much.
Thanks a lot, sir. Thank you.
Bye, bye.